Good afternoon, everyone. Hopefully you've had a fruitful morning. Let's have a round of applause for all of our speakers again. And welcome to the Health Braintrust Awards Luncheon and Town Hall. I have the distinct honor of introducing the Outstanding Legislator Leadership Award. Michelle Lujan Grisham is serving her second term representing New Mexico's 1st Congressional District. Congressman Lujan Grisham, a 12th-generation New Mexican, has dedicated her life to serving her community, fighting for seniors and veterans, and building an economy that works for all New Mexicans. Congresswoman Lujan Grisham has built a reputation both in New Mexico and in Congress as a hardworking representative who always puts her constituents first. During her first term, she stood up for veterans and their families, protected good-paying jobs at Kirkland Air Force Base, and held bureaucrats accountable for cleaning up the jet fuel spill that threatens our drinking water. She also passed legislation to invest in appropriate training for police, protect the Sandia Mountains, and restore $16 million to rebuild an elementary school that serves at-risk kids. A longtime advocate for the most vulnerable citizens, Congressman Lujan Grisham is working to lift the state out of poverty by creating opportunities for New Mexico's families. She is pushing an ambitious plan called Care Corps that would provide support for family caregivers and help meet the growing demand for the care of aging and disabled Americans. A former business owner, Bernalillo County Commissioner, Secretary of Health, and Secretary of Aging and Long-Term Services, Representative Lujan Grisham now services on the 3 committees in the U.S. House of Representatives, Budget Committee, Agricultural Committee, and we serve together on Oversight and Government Reform Committee. She was also selected by her colleagues to serve as first Vice Chair of the Congressional Hispanic Caucus. It is my honor and pleasure to present to you an award, Congresswoman Lujan Grisham. And just a little tidbit, we also play on the softball team together. I'm worse than she is.
Wow.
Oh, this is heavy.
This is bigger than I am.
She's also the shortest person in Congress.
Wow. This is incredible. That's beautiful. Wow. Thank you, Congresswoman Kelly, and thank you to the CBC Braintrust. I really, as a member of Congress, and I know that my colleague Robin would say the same thing, we actually get incredible support by so many advocacy organizations, and all too often I feel a little embarrassed by that recognition and that support, because the truth is, the folks who are here today for this conference and for the training and for doing the research and the continuing education, you're the folks that are making the valuable contributions and the differences every day that I know in the end will make the kind of impacts in my state that is still today really struggling. And for me, and for every person in this room, and for my esteemed colleague, this is a matter of justice. This is health justice and health equity. Thank you. And I hope that when I come back to a conference to support the next set of award recipients or highlight the next best generation of research, that we're not talking about the disparities, because we know those measurements. We don't need to measure it anymore, and we know what makes a difference. We want to see that there's progress on making sure that health justice occurs in this country so that all populations and the minority populations in our districts and our states are impacted in ways that we know make a real difference. And I want to do just 3 quick things while I'm here. One, I'm going to do this backwards. This is what's great about Congress. I don't have to call her Congresswoman. I love Robin. I met her when she first got elected. She talked a little bit about our softball team, and we raise money for young victims and survivors of breast cancer. And it's another recognition that as you look at gender and ethnicity, you look at poverty, you look at our minority communities around this country, that there's so much work to do. And it's great to see that you've got another champion who's fully engaged and really understands these issues. issues. Another issue that I spend a lot of time, I just did it today at lunch, that I talked to Robin about is my career by accident really focused. I was lucky. I just fell into a job where I got to advocate on behalf of seniors, and particularly minority seniors, Native American elders, Hispanic elders, African American elders in my state, who were really in rural and frontier communities, were in a situation they had no support. And in fact, New Mexico was the worst in the country for investments outside of nursing homes. You got sick, you're poor, you went into a nursing home, you left your community, you left your family. For those Native American elders, they left their language, all of their cultural significance, all of it. They left their healers, and they were put in nursing homes where their health declined at such more dramatic levels than their Anglo counterparts. And I can tell you, how many people in this room want to go to nursing homes? Everyone? Anyone? Nope. And while I don't want to disparage that level of care is necessary for so many individuals, A, it should be high quality, and B, we should be doing everything in our power to prevent that work. And let me tell you who's preventing that. Families are preventing that. And let me tell you who in those families. Minority women are standing up. They're providing literally hundreds, more than $500 billion worth of care to their families every year. And you know what happens when they provide that care? They make less, they're less healthy, they don't have the right emotional support. So when we talk about changing this environment, that we're going to invest so we don't have generations of health issues, that there really is justice in the way in which we approach health policy. And we're going to have to figure out caregiving. Now, I'm a caregiver for my mom. She lives with me. And last week, she fell and broke her hip. This is no good. And she's now in rehab in Albuquerque, New Mexico, and I'm here. You know who's taking care of my mom, who's doing an incredible job, who's managing 2 full-time jobs, who's there every morning and every night, who makes sure that my mom is clean and supported, that someone's assisting her with her meals, because she can't do any of that herself, let alone make sure that the therapy is occurring when it's supposed to be occurring. Who is doing that? My 28-year-old daughter. Hispanic young woman who's exhausted, who's calling in for work, who has exhausted her sick leave, and I think about how I'm creating the same kinds of problems for the next generation. So here's what CareCorps does. Instead of having this debate in healthcare policy about Medicare and Medicaid, why don't we invest in a national service program just like the Peace Corps? Let's do it here in the United States. Let's take young people from New York, let's put them in New Mexico, let's have them serve on a Native American reservation, a culture that they would never have access to. Let's have them be unskilled caregivers. Let's have that person give my daughter a break at 7 o'clock in the morning, and who respects and cares about my mom, who develops a relationship and an understanding about healthcare, who understands disparity, who is working towards justice. We create an intergenerational movement. And then how about, in addition to housing and stipends, we put these kids into college, into healthcare tracks, so that they are creating that environment that we know is missing in appropriate care that's designated, that's culturally relevant to the populations that we're serving all across the country. And for those students that left college because of debt, how about if we pay down some of that debt? So I am really excited about this concept, and I would love for your support, because I know that you recognize and understand the value of those investments in our own country. The next thing I want to tell you that I'm grateful for is I've got a bill called HEAL. This is to make sure that legal immigrants are not barred. They're basically discriminated against. They can't buy insurance on the exchange. They can't get subsidies. They can't get into Medicaid. They have a 5-year bar. When they have sick kids, they're out of all of the systems that are really aimed to shore up. So we're creating, again, huge injustice, complete discrimination to a legal migrant community in this country. It's outrageous. The United Nations has endorsed this bill. I'm very excited. We're going to keep working hard. And then what I should have done first, The Kelly report, the aspects about nutrition, about really being clear that if we don't make sure that we get these kids all over this country the kind of nutritional support aimed at making a difference in both their health outlook and their educational outlooks, then we can't get ahead. And New Mexico, when I came to Congress, was one of the worst in terms of child hunger in the country. Now we're fourth. It's still untenable. And it's this kind of work and this kind of leadership by the Black Caucus and by my colleague and my really dear friend, Robin Kelly, that I know will reach into the hearts and the minds of our colleagues and get them to make the investments that we know will once and for all make a difference. Thank you for your leadership. I'm so honored to have this award. Big enough muscles, I could have done it.
No. Thank you. Thank you so much, Michelle. And now for the Outstanding Corporate Leadership Award. Maurice Smith is responsible for all Blue Cross and Blue Shield of Illinois operations, including the management for sales and account management, provider network contracting, medical management, government relations, and public affairs. Phew. Before assuming his current position in 2015, Smith led the Healthcare Service Corporation, Treasury Department, and corporate development initiatives, including mergers, acquisitions, and the formation of strategic partnerships, and was focused on the key role capital deployment plays in corporate strategy. He also oversaw HCSC's subsidiaries. Previously, he served as Vice President, Corporate Transactions and Business Analysis, with responsibilities for negotiating various mergers, acquisitions, and strategic relationships, as well as corporate financial forecasting. Smith holds a bachelor's degree in business administration with a concentration in accounting from Roosevelt University in Chicago, Illinois. I'd like to present the Outstanding Corporate Leadership Award to Maurice Smith. Plus, he gives me health care. I've had Blue Cross Blue Shield for a long time.
You do need quite a bit of muscles to pick that up, though. Thank you, Congressman Kelly. Thank you for that kind introduction. You're a true advocate for Illinois, and we really appreciate it, and I'm proud to call you a friend. Thank you. I would be remiss if I did not recognize two board members that were here with me tonight. One is out of the room, but soon to be back, hopefully. Director Michelle Collins and Chairman of our board, Milton Carroll. So good afternoon, ladies and gentlemen. Thank you. I'm humbled to receive this award today. While I mark my start of my second term as the president of Blue Cross and Blue Shield and my 23rd year with the organization, Blue Cross celebrates its 80 years serving the people of Illinois, 80 years of ensuring access to doctors and caregivers, 80 years of providing a peace of mind, and I'm proud of our legacy, personally, and the dedication to healthier Illinois. As president and leader of Blue Cross, I'm working to build on that legacy, ensuring that what we do increases access to high-quality health care, which you heard a lot of people talk about today, to all Illinois citizens, including those in underserved communities and those who have not had the full chance to access health care, quality health care. And we know that serious health disparities persist. Breast cancer survivor rates, way different. Serious complications from diabetes are way different between populations. That needs to be changed. These are transformative times for our industry, and we recognize the important role that health insurance play to make up the transformational success. At Blue Cross of Illinois, we have entered new markets to reach healthcare consumers at all points in their lives, meaning whether you're in a government program, a retail program, or a group program, we want to touch you. We insure 430,000 Illinois retail consumers. Those are the individuals that buy care for themselves or for their families. This includes more than 185,000 consumers who bought their insurance on the Illinois Exchange, which was established under the Affordable Care Act. And we're now in managed Medicaid. We cover over 300,000 members in the Medicaid space, giving members access to care coordinators, and for the first time in their lives, in many cases, the right care at the right time. These new markets have clearly increased access to care for many. But the demand on services by consumers with previously unmet needs is high. And it raises challenges for the affordability of care and the sustainability of these new markets. My team is working to ensure that we do everything we can to collaborate within health systems in Illinois, both the doctors and the hospitals, to keep the costs very affordable. Last week, we announced a new oncology program, for example, where we work with Illinois cancer specialists to identify members who are receiving chemotherapy or hormone therapy and have diagnosis of colon, lung, breast, or prostate cancers. Members in this program, members can receive free services from an oncology certified nurse and receive treatment education, advanced care planning, and hospice services if needed. This is just one example of how many things we're doing to collaborate with providers to share the responsibility to provide access to quality, affordable care. I'm also focused on the communities we serve by partnering with innovative community organizations to address critical healthcare needs and gaps and reduce health disparities. In 2015, our company partnered with over 500 community organizations through our grant and sponsorship programs. We sought community input on their most pressing concerns, so we engaged them in this process and collaborated with the organizations that we thought would be most appropriate and make meaningful differences in moving on these issues. We're working with the Chicago Department of Health, Chicago Public Schools, University of Chicago, all of the policy and research groups that you can think of to improve the overall care and reduce the health disparities with all our partners. We're also working, in certain cases, with Sinai Urban Institute in the North and South London areas of the city to develop highly trained body of people, health workers to reach out in neighborhoods to help people lower their A1C levels as it comes to diabetes. Very important. My aim is simple. It's to create meaningful, long-lasting change, make a difference. I understand that those changes won't happen overnight, but I'm committed to making it happen in Illinois and on the behalf of the health of all of its citizens. We're here for the long haul. We've been here for 80 years. We will continue to be here, and it's important to me that we remain here and relevant. I deeply appreciate this award, Congressman Kelly. It energizes my commitment to giving back to communities, which I love so much, and my desire to build a sustainable path for health coverage for all. Thank you again. I really appreciate it.
Hey, good afternoon, everyone. Congratulations again. We are the Brandons, if you may know us. And the Brandons are fifth of it. There's also a Casey back there. There's a Matt. And there's an Audra that's much better at doing this, but she let us do this part of it today. We just want to go ahead and they have two students that Congresswoman Kelly met and mentored at the University of Illinois Dental, and they just wanted to stop by today, so she wanted to make sure we gave them a shout out while we could. And then two, as the staffers, we wanted to make sure that we had the opportunity to give out the staff award to Mr. Marvin Figueroa. So when we were talking about who we should give this award to, who we should nominate, a lot of times everybody outside the Hill and in other committees in health and science, they would give us suggestions. This year we kept getting one suggestion over and over and over again, and that's Mr. Figueroa. And so instead of us introducing him, we're going to let his former chief of staff, Mr. Luke Albee, introduce him, who knows him and knows his work. So Luke.
Good afternoon. Back when Marvin was a boy, a little boy, in the summer of 1988 at the Democratic Convention, the keynote speaker was a very progressive, memorable governor of Texas, a woman named Ann Richards. And she gave the keynote speech. Does anyone remember that? Any golden agers out there like me? She had a line about George Bush the first, and that was, he was born on third base and thought he hit a triple. Our honoree today, Marvin Figueroa, actually wasn't born on third base. He was born in a little village in Honduras. He came to this country with his mom as a 5-year-old. He told me he officially learned English as a 6th grader. And I met Marvin when he showed up in our office one day as a Hispanic fellow. And we all instantly fell in love with him because he has an incredible brain. He has an incredible sense of humor. He is willing to take on new issues, first education, and then the kind of thorniest, gnarliest issue of all, healthcare. And he did it for Senator Mark Warner. I worked for Senator Leahy for 20 years. I worked for Senator Warner. I was his chief of staff for 6. And it's fair to say when you work for Senator Mark Warner, if you can make it there, you can make it anywhere. So anyway, I'm thrilled to be here to be part of this award ceremony. I think one thing all of us, especially any of us who've ever had children, know is that the most important person in your life is your mother. And Marvin's mother is here. She's the one who brought Marvin to this country, and I think we should all acknowledge her. So thank you, everyone, and thank you, Marvin.
Good afternoon, everyone. I know you've heard this all day today, but I'll keep my remarks brief. I want to start off by thanking Congresswoman Kelly. I think the issues that you're bringing up, the awareness that you're creating is uncomfortable, but is indeed necessary. I would be remiss to not talk about also Congresswoman Lujan Grisham. As a former Congressional Hispanic Caucus Fellow, I am very proud of the work that you do. I will, again, keep my remarks brief. I want to thank 3 people, and I'll get off your hair. One is Luke Albee. Luke was our chief of staff, and Luke was an incredible leader. He is someone who has taught me that the journey is the reward, someone who's always encouraged me to take my seat at the table, and someone who's always told me that I have to tell my story because my story is powerful. And I am indeed grateful for Luke Albee. I also want to thank Elizabeth Falcone. That's my LD right there. She was my LA, so I was her LC. And it was from Elizabeth that I learned how difficult things are and how much work you have to put into being great. I remember I used to go and come back. I used to go to the gym and come back, and she was still there working, trying to figure out the thorniest issues. And it's from her that I learned what it means to be an excellent healthcare staffer. Today I am proud to be her LA, and she is my LD. Last but certainly not least, I want to thank my mother. And I don't usually talk about my mother because I get emotional. My mother came to this country when she was 30, and she brought me along. And she was a home health aide, which is back-breaking work. And I remember when I was in high school, I told my mom continuously that I wanted to work. I wanted to work because I saw how difficult it was for her. And she always told me that my contribution to that house was to graduate from college, to go to grad school, and make something out of myself. And I am someone because of her. So I want to begin with that ending, that I want to encourage you all to continue to invest in kids that come from single-parent homes from the Bronx. I want you all to keep looking at those kids from Oakland, those kids from Richmond, Virginia, from Hampton, because we could be great too. Thank you. Thank you. Sorry, it's picture time. I appreciate it.
All right, well, wow. Start with that, and then congratulations again. I would like to now bring up our panel, our luncheon panel, headed up by Ms. Dr. LaTasha Seliby, who is a physician originally from Mississippi, and one of our 40 under 40 honorees today. She's going to lead this panel as we talk about diversity in the workspace and getting more people opportunities like Mr. Figueroa did. Thank you.
Well, good afternoon, everyone. Food good? Y'all full? No itis, okay? Everybody must participate. Just making sure y'all know that. Okay, so today I'm LaTasha Seliby. I'm a family medicine physician by training, college medicine physician by practice. I work at Georgetown Student Health Center. I finished a health and media and faculty development fellowship last year and decided to stay on at good old Georgetown. And I said it earlier, but I am a big fan of mentorship, and I love that we're talking about pipeline programming today. And we started off by talking about getting kids interested in STEM. And we followed that about talking about the leaky pipeline. Today at lunch, we're going to talk about we got these students through high school and STEM and college and graduate school. Now let's get them gainfully employed. How about that? So we're going to talk to this panel, and our panel is full of industry experts, leaders in medicine and nursing, and we're going to talk about promoting diversity, recruitment, and keeping that talent in these places, in these circles. Our first panelist is Dr. Cherie Prentice. She is a proven visionary, author, and highly sought-after physician leader. She's a board-certified occupational and environmental medicine physician, public health expert, and a breast cancer survivor. Dr. Prentice got her bachelor's degree. Oh, yeah. Pause for the cause, yes, absolutely. She got her bachelor's degree from Northwestern University, MD from Loyola Stench School of Medicine, an MPH from the University of Illinois School of Public Health, and she is a member of the American College of Occupational Environmental Medicine as a fellow, director of the board, and CPE, which is Certified Physician Executive Tutorial Teaching Fellow of the American Association of Physician Leadership. That's Dr. Cherie Prentice. Give her a hand. All right. Our next panelist is Dr. Patrice Harris. She has a diverse experience in private practice physician. She's a public health administrator, a patient advocate, and medical society lobbyist. She has been in organized medicine her entire career. She's held multiple national and state level leadership positions, one of which was she was elected in the American Medical Association Board of Trustees back in June 2011. She has also been on the board of the American Psychiatric Association and was a delegate for the AMA. She's an AMA Women's Physician Congress governing council member. Dr. Harris has held many positions in the state level as well, one of which was the founding president of the Georgia Psychiatric Political Action Committee. Currently, Dr. Harris continues to practice in private practice. She consults both public and private organizations on health service delivery and emerging trends and practice in health policy. This is Dr. Patrice Harris. Third is Ms. Gloria Gamage. She has earned a bachelor's and a master's in nursing from California State Dominguez Hills. Ms. Gambage began her career as an emergency department nurse in Southern California. She has served in the role of chief nurse, trauma program director, critical care directing, and chief nursing officer. She received her training at King Drew Medical Center. She is currently the chief of nursing officer at Howard University. As of October 2015. She's the chief nursing officer where she directs, supervises the nursing staff, as well as clinical oversight for nursing practice throughout the entire medical system. This Ms. Gloria Gamage. And last but not least is Ms. Monica Turnbull, Dr. Monica Turnbull. Monica Turnbull is Vice President and Chief Diversity Officer for Healthcare Service Corporation, which is the parent company of Blue Cross Blue Shield plans in Illinois, Montana, New Mexico, and Oklahoma, and Texas. Monica holds a master's degree and PhD from the Chicago School of Professional Psychology, where she also serves on the Board of Trustees. She's a 2015 Leadership Greater Chicago Fellow and serves as the LGEC's Board of Directors. In her role, Monica is responsible for managing HCSC's Center for Diversity and Inclusion initiatives, ensuring that diversity and inclusion remain cornerstones for HCSC's culture and continues to be integrated into the business operations. So that's our panel. Let's give everybody a hand. So we're gonna keep this general. The first question that each of our panelists is gonna answer is gonna start with Dr. Cherie Prentice. What are things that your organization or you're doing to promote diversity in the healthcare ecosystem, and what challenges do you face?
Okay, well, let me first start off by saying I'm an entrepreneur. So what my organization is doing means what I'm doing and putting my feet to the pavement. I realized when I began medical school that having a diverse physician workforce is a critical component to getting healthcare to the people that need it most. And unfortunately, a lack of diversity among medical students, coupled with ineffective cultural competency education, continues to promote and create training and treatment environments that are biased, intolerant, and contributory to healthcare disparities. When I entered medical school back in 1989, there were 2 African American students amongst the class of 132. It was me and one other black male. By the time we graduated, there were 2 black females and 2 black males. And you wonder, well, how did that happen? Well, lo and behold, the additional black female and black male were held back from a previous year. I was told that this one particular course, biochemistry, was notorious for holding back minorities. And I was told to beware. Well, in my mind, I'm thinking, well, I'm good with biochem. They just didn't study. Well, lo and behold, I took biochem, and I found the same thing about to happen to me. But those professors didn't count on the fact that my mother was a systemic investigator for EEOC, and my father was a systemic investigator for the U.S. Department of Education Office of Civil Rights. So what turned out was not only did I not get held back, but I developed a relationship. I stayed in that dean's office on a daily basis. Everybody knew my name, my full name. And I went back to my medical school, and I made sure in my 3rd and 4th year, I availed myself, and I went to Xavier, I went to Chicago State, I went to every university that I could fit into my schedule in an attempt to try to increase enrollment at the school, but with the promise that they were going to make change. And so for the past nearly 25 years now of my medical career, I do 3 things. 1, I advocate for increasing representation of underrepresented minorities so that we can increase applicants and acceptances. 2, educate medical students, medical professionals, and the public on the relationship between diversity and disparities. And lastly, advocating for adequate and appropriate cultural competency within our medical education so that our healthcare professionals will be appropriately trained to address our health disparities.
Thank you, Dr. Prentice. Dr. Patrice Harris?
Yes, thank you. And we were kindred spirits. As some of you heard last night, I'm from West Virginia. When I was in medical school, there was one in all 4 years, and that was me. And so I too, luckily I went back to medical school as an older student though, and so that's something to consider, because maybe had I been 22, I may not have had the wherewithal to advocate for myself as much as I did. And so we have to make sure that support exists in other areas. So I'm here today, and I'm going to speak on behalf of the AMA, and then something that I did when I was a health director in Fulton County. But the AMA's signature program, as we address the pipeline issue, is led by our wonderful Minority Affairs section. And I will say that that in and of itself is a good thing, because that's an opportunity. First of all, it's a recognition that we do need an opportunity for underrepresented communities to network, to share ideas, to support one another. I was telling the story last night that one of the things I did was come to Atlanta to the SNMA meeting. I was so thrilled to see other people of color, medical students of color, and it really got me through the next couple of years of medical school. So we have to make sure that those opportunities exist. And I think that is one of the things that is the opportunity of the MOS, is that physicians get together and network, talk about issues, and most importantly, talk about solutions. And under the wonderful leadership of the MOS, the AMA has the Doctors Back to School program. And that's where physicians do go into communities, and we reach and talk to elementary school levels, because we have to start there. And we can also have a separate conversation about the whole K through 12 issue, which I think is something that we have to address as we're talking about the pipeline issue for any profession. But we have these wonderful dedicated physicians who go and work and demonstrate that, yes, you too can be a physician. You too can have a career in a STEM area, and I think that that's critical. And I'm excited to say that typically our Doctors Back to School program was related to one of our meetings, but it's going national. But tomorrow, how many of you physicians are going to a school tomorrow to show youngsters that, yes, you can have a career in the health field? And I will say that this past year, our interim meeting was in Atlanta. That's my hometown now. And the Atlanta public school system was over the moon about that program. So sometimes we think that's a small thing to do. It turns into a huge thing to do. So just wanted to highlight those two areas that the American Medical Association supports. Actually, I told a fib. One more thing, you talked about leadership. It's important for physicians and other folks to be trained in leadership. We are often at the table when issues are discussed or not discussed, and it takes a leader to raise these issues. And so the AMA, we're in the early stages of thinking about this, wants to figure out a way where we can uplift physicians to be leaders on this issue and others.
Great. Thank you, Dr. Harris. Next, we have Ms. Gloria Gamage from Howard University.
Good afternoon. So I too, as a nurse, have experienced where start off where the audience, and even as a nursing student, there was a large cast of non-minorities, and then dwindled down, and then my graduating class, I end up being one of two who graduated as a minority in that class. And so when I think about that in my leadership role, is that it's important, and I encourage all nursing and all disciplines that you join professional organizations, because in that arena, when you attend those meetings and organizations, again, you see that there is a small amount of minorities participating in that. And then casting the net within our own circle, looking at, again, you mentioned this, elementary schools, but also all schools, and just encouraging from elementary all the way up to all the universities to be active, participate. Look at the church. I have been very active in the AME organization in California, where we have back to school and health fairs. And as a healthcare member in that arena, was able to recruit and redirect and say, you know, you're thinking about business or whatever, those are fine, but healthcare is a nice stable field. And so to drive and just make sure that you have that network within your community, looking at church, looking at school, and then also the formal organizations. In terms of within the Howard setting and in my role as a chief nursing officer, some of the things that I look at is retaining those individuals. Howard is connected to the university, and so it's very important to have those nursing students come and fill the vacancies within our hospital versus going outside of Howard. And so that's one of the ways that I am looking at keeping that diversity within our circle. Okay.
Thank you, Ms. Gamage. Last but not least, Dr. Monica Turnbull.
Thank you. Thank you. I'm glad to be here today, and I'm thrilled to be able to present a payer's perspective on diversity pipelining. Obviously, as through the introduction, as you know, I'm the Chief Diversity Officer for Healthcare Service Corporation, so this is a passion of mine. And I know throughout the day, throughout this, the STEM has been talked about a lot, but I really wanted to use this opportunity to share with this group, an exciting program that we launched at the beginning of this year at Healthcare Service Corporation, which is our STEM programming strategy. And so, as you heard, Healthcare Service Corporation is the parent company for 5 Blue Cross and Blue Shield plans, Illinois, Texas, New Mexico, Oklahoma, and Montana. And so, as I've been working with my team and working with other internal stakeholders for each of those markets, STEM and how that shows up is very different. It's very different from Illinois than it is in what that means for Montana. And so, it's wonderful for us because we get to play in these very different spaces, but our feeling and our approach is the same. And that is, as we look at our organization, as we look at our 5-year strategy, we know in the healthcare field, particularly in the health insurance field, that attracting and retaining talent, STEM-focused talent, is going to be vital to us having a successful future. And for us at Healthcare Service Corporation, we know that education disparities begets financial disparities, begets healthcare disparities. So for us not to recognize that and be proactive and do something about that, we're taking our eye off of the ball. And so with our STEM program strategy, we launched, like I said, at the beginning of this year. And right now we're in the beginning of cultivating what we call our STEM partnership channels, whether it be community service organizations, elementary school, high school, various colleges and universities, and looking at how do we develop a program internally, homegrown. So it's an exciting time for us, and we recognize, and we also have to look at what are we doing internally. I think the question was what are some of the challenges to getting there? And I think some of the challenges is getting whether it be kids at the K through 12, at the middle school, high school, colleges, getting them interested and excited about health insurance from our perspective. I've been with the company for 10 years, but I can tell you when I was coming out of undergrad, I did not say I want to go work for a health insurance company. It was something I had mentors that pointed me in kind of the right direction, but it was really something that, how do you get that out there? How do you get that exposure? And I think building a STEM program, specifically helping to educate young professionals, even younger students, on what this can mean. If we have enough time, or if anyone wants to grab me offline, I can share with you those roles within our company that aligns to our profession, our science professions, our technology professions, our engineering professions, and our math professions that may not seem as clear-cut from a health insurance corporation. So really excited about that, and just really wanted to take a moment to share what we're doing in that space around developing our STEM strategy.
Wonderful. Thank you, ladies. I'm going to, in the essence of time, I'm going to open the floor for questions. So if anyone has any questions for our panel, please go to the microphones, and while you decide or think about your question, I'm going to take the liberty of asking one myself, and anyone can answer this if they like. So we're talking about promoting diversity in the challenges. What are some of the things that you feel your organization can do to help retain and develop the talent once you have it?
My first answer to that would always be there's education and training. And you have to mentor, and then you have to lead by example. And I think that those are the key elements. One of the other things that I didn't mention is that in terms of when you think about mentoring, it starts at an early age. So if you are PTA moms or dads, when they have career fairs at the school, I encourage you to go and make healthcare the subject to help recruit.
Thank you, Ms. Gamage. We'll go for our first question. This mic here.
Good afternoon. I'm Suzanne Wu from Howard University College of Nursing. And I would like just to add that for what you mentioned now, the nursing officer for Howard University Hospital. Thanks for your support for the nursing students to come, for the nurses to come back for the FMP program at Howard, because you are really gaining them, and the retention rate will be much higher when they are really educated at higher level. And that will benefit the community as well, because most of them are minority. Okay, and for the first panelist, I would like to ask you, what are the initiatives now you are doing related to the cultural diversity and inclusion, knowing that when you were in the College of Medicine, maybe you didn't have course or a specific separate course in cultural diversity, comparing to now, which is still fraction. I'm serious, because I teach cultural diversity for family nurse practitioners, but I know how much they need it, and how the impact of understanding the cultural background of our patient in the service we can give them. It doesn't matter if you are African American serving Hispanic or serving Middle East or whatever, you can be prepared in the classroom, but not to be left for you to do it on your own. So I would like to know what other initiatives you are taking care of.
Well, actually, my work began, like I stated, when I was in medical school, and when I complained and argued and yelled and screamed, they said, okay, well, you get out there and you start working on recruiting. And then I said, okay, if I can do that, then I need you to start working on getting rid of those bad influences that would hold us back. And when I graduated from medical school, I actually did my neurology residency back at Loyola, and I made myself available again and got on the road. I pushed and pushed and pushed, and now finally, they actually have a dean of minority student affairs. And so now her and I, we can clap for that, because that is great news for Loyola Stritch School of Medicine. I am now working with her to develop a curriculum that will actually be culturally competent for our minority students. And I'm going to start there, because that's my alma mater. That's where I had my issues. So if I can develop it there and use it as a pilot, we're hoping that we'll be able to take that on to additional schools within the city of Chicago and then hopefully abroad.
Perfect.
Thank you, Ms. Gamish. I'm sorry, we have to go to the next question.
Sorry, just to continue this one, just a second only.
We have 11 minutes.
Okay.
I really want to get to the next question. You can talk to her offline, I promise. Thank you. So the next.
Hello, everybody. I'm Vapor Robinson, and I'm a full-time faculty at Coppin State University in Baltimore. And this question is a little bit personal. I've heard for the past 2 days that everyone spoke who said that there are all these wonderful programs out there to help youth and mentor youth to go to college. But I want to share with you a personal story about my daughter. She wanted to be a physician ever since she was in middle school. I tried to get her a mentor, a female physician, and everywhere I went to help her, I was turned down. Finally, she went off to college in Baltimore, in Maryland, and after her first semester, her major changed. She came home after the first semester, she wants to do public health. So she went on and got a bachelor's in public health, she got a master's in epidemiology, and now she's getting a PhD in public health. Now that sounds wonderful, but after listening to all of you today, I felt like she was shortchanged. So I'm asking, I have 3 grandchildren, and I'm asking, where is a central area where if one of my grandchildren wants to become a physician, where can they go to find all this wonderful help? Is there some place that I can go, start looking now, so that I can help them in the future? Because I do not want them to be shortchanged if they really want to be a physician. Thank you.
I'll take that, and actually what you did is stimulate an idea. That's a great idea, because this happens a lot. We come to conferences, there's lots of great ideas, but after the conference, we're like, okay, now where is it that I could go? And it's about repositories. So I'm not going to say the AMA can own that. I have to go back, but I think somebody should, and maybe later, and some of the leaders in this conference can figure out that. I think that's very important. It's not too much about me, but I want to share that I went to medical school wanting to be a physician since the 8th grade. But when I got there, my advisor told me that I should be a nurse. There's nothing wrong with being a nurse. It's just that that's not what I wanted to do. I listened to her. I applied for nursing school. I got in nursing school, fortunately. Probably have to be smarter to be a nurse than a doctor, but so luckily I got in. But I was at orientation, and I said, this is great. Nursing is a wonderful profession, but it wasn't for me. So I was going to say get off track, but I'm of the age now where I just appreciate every journey. But I said, you know what? I got frustrated. And I went another track and eventually got back to medical school. But the thing is that's very important because you get messages out there from others and you have to make sure. And so I'll take that as an idea and maybe we can come up with that. And I'll say one more thing though about lack of role models. We also have to be careful we have to figure out a way not to burn out our mentors and our role models. Because, you get put on every committee, you get, if you're the only one, and then you forget to take care of your own career, and then where you are. So there's balance in this whole process, and these are the things that we have to keep thinking about. But I think that's a great suggestion, and I'll take that on to see what I can do.
Thank you, Dr. Harris.
Good afternoon. Dr. Neva Lubin-Johnson, Chair of the Minority Affairs Section of the American Medical Association. And Dr. Harris and I spent some time chatting last evening. What I didn't tell you was that is something that we decided to take on, is coming up with a page on the My section of the AMA website. That decision was last weekend. So give us about 6 months. And hopefully in that time we will have garnered all the information about all pipeline programs in the country that start in grade school and go through college. All right. And I say through college because we've talked about a little bit about AAMC report about men in medical school today. Over, I think it's 60% of black males, of black students who major in pre-med don't take the MCAT. And we think part of that reason is low self-esteem, being misadvised, et cetera. I just want to say a couple other things about Doctors Back to School. Last year there were visits and encounters with over 10,000 children across the country. And on May 3rd will be our first National Doctors Back to School Day. So thank you.
Good afternoon. My name is Dr. Lauren Robinson. I'm the Deputy Secretary for Health Promotion and Disease Prevention for the state of Pennsylvania. And I just wanted to say in response to the sister's comment earlier, the AAMC has been taking this on, and so especially for kids who are in middle and high school years, there's a part of the AAMC website called aspiringdocs.com. But that's a really good place for kids to start find out information on what they need to do, who they need to reach out to, and it has kind of some feedback and some points of contact for people who are all along the process. So there are medical students, there are residents, there are fellows, there are attendings who have given and kind of put their information out there to serve as mentors and serve as resources to put people in contact. And I think it is really important to mentor and give back, and you can do that at any part of your journey. You do have to do self-care and make sure that you don't burn out, but my mentor, Dr. Bright, is right over there, and he's one of the reasons I made it through Duke for med school, and so I want to give him a shout out and say thank you, but also thank you to the panel this morning.
Good afternoon. My name is Cherie Wilson. I'm the Director of Diversity and Inclusion at the Robert Wood Johnson University Hospital in New Jersey. The question I have is, what do you think of people who are career changers who come to the healthcare arena? So I'm someone who has a weird background. I was actually a Russian history professor in my previous career before I came to healthcare 13 years ago. And you have people who have been teachers, computer programmers, a whole plethora of fields, and then they decide they'd like to come into healthcare. So now I know for medicine, there are a few programs in the country, like humanities and medicine, where you could be a philosophy major or an English lit major or something to that effect. They don't take the MCAT, they don't take a lot of the hard sciences, and then when they look at those programs, they found out that with those soft skills, they're actually much better with patients. The graduation rates are the same. So might that be another avenue to encourage people to pursue these fields? Just oh, okay. I just wanted to put that out there. So thank you.
Okay, we have time for 2 more questions, so you can go ahead, sir.
Mine is more of an announcement. First of all, thank you very much for everyone. My name is Craig Johnson, and I staff the AMA Minority Affairs section. Thank you to the 80-plus physicians who volunteered for tomorrow for the Doctors Back to School program. If you got a confirmation from me, please see me at this end of the room immediately following this event, and I'll give you some updates. For those of you who got a sorry, but we can't work with you this year, it was an overwhelming response, and we're grateful. We happen to have space restrictions, which is, I guess a good problem to have. So we, again, hope that you will do something in your local community for Doctors Back to School on May 3rd. Thank you.
My name is Jan Robinson, and I'm a pediatric nurse practitioner, and I've been a nurse practitioner about 40 years. I'm concerned because there is a current move abreast to have nurse practitioners have PhDs. And by 2020, that's what the nurse practitioner schools around the country, universities want. I don't think we need every nurse practitioner to be a PhD. As a nurse practitioner for the last 40 years, now I'm in school health, I can impact children every day. And I think it would behoove us to say, why are you pushing for this right now? They already did away with the 3-year nursing program. The two-year nursing program in New York State is now not hiring, and they're doing away with that. So 4 years and then a PhD to be a nurse practitioner. I think we need to say we need more physicians. We need more physician extenders. Why make it more punitive to get into those positions? And I think that this is a forum that we could do something to make our voice heard. Thank you.
So we're wrapping up the end of the panel. Ladies, if there's any closing remarks that you have to kind of round out, and for everyone, the ladies will be around for you to answer questions one-on-one if you like. Dr. Prentice?
Well, I'd just like to say that I am indeed honored. I remember growing up and seeing my dad watch PBS and seeing panels like this, and most of the time there were no individuals that looked like us. And if there was, maybe there was one. And I remember saying, man, I would love to be able to be in a position where you're making policy changes and you're talking science, and it's so, wow. And look at God, 8-year breast cancer survivor, entrepreneur, practicing medicine for 25 years, and I get the opportunity to be on the stage with beautiful women, smart women, and in a room full of individuals who want to make a change and have a passion deep down inside, and know that where we are right now, although we've come a long way, we have a long way to go, and we're willing to put our feet to the pavement, get in the grind, and make it happen. I'm blessed.
Dr. Harris?
And I'm not going to try to top that, except to say ditto.
Ms. Gamage?
Well, I am honored to be here, and thank you for inviting me. So on behalf of Howard University Hospital and Paladin Healthcare, thank you, and amen, sister.
Dr. Turnbull?
I would just say, without sounding too corporate-y, that this STEM pipelining, diversity and inclusion, it only works within organizations if it starts from commitment and leadership at the top. And I can tell you, sitting here right in front of me, a table of leaders in our organization from Maurice Smith, who I used to be Maurice's chief of staff before I took on my chief diversity officer role. For Maurice Smith being our first African-American president at Blue Cross and Blue Shield, and one of the youngest presidents we've ever had there. We have one of our board members, Ms. Michelle Collins, here as well. We have Teresa Doyle, who is leads our government relations office here in DC. I think for me to be able to step into this role and take on something like this without the commitment and the leadership here, it would be an exercise in futility. So I really think, again, without sounding too corporate, it does start at the top, and the commitment to continue to drive this forward. So I do want to give a shout to my leadership team here from HCSC and Blue Cross and Blue Shield, and thank you for the support. So,
thank you, ladies. My goal was to not get that red light, but I did anyway, but it's okay. I will have Congresswoman Kelly come back.
I just wanted us to give the moderator and our panelists another great round of applause. And I'm a shoe person, so I'm checking out the shoes up here too. I like them. But anyway, we're going to have about a 10 to 15 minute break and then come back for our next event. So thank you.